Swimming is a recommended physical activity to work out our bodies and exercise them. But how many of you out there take care and take time to ask the composition of the water in a swimming pool? If you have never thought about this, now is the time to interest yourself in understanding what kind of water you are going to swim in. Because the 15-year study published by the Center for Disease Control in May this year shows that most of the outbreaks can be traced back to water contaminated with pathogens or chemicals. In the study, recreational water from 46 states in America recorded 493 outbreaks associated with treated recreational water. These outbreaks resulted in at least 27,219 cases and 8 deaths. Among the 363 outbreaks with a confirmed infectious cause, 212 were caused by Cryptosporidium, which causes predominantly gastrointestinal illnesses. Whereas such a study has not been done here in Uganda, James Taban, who has been working for over a decade as a swimming pool supervisor for the Kampala Serena Hotel, says most swimmers are ignorant about recreational water.
When they see a pool, they really, especially with our sparkling pool, the moment they step at the entry, said, "Oh my God." None of them will ask you what chemical are you using. Very few, very few. Out of 100, maybe 2% will ask you such a question.
However, Taban says swimming pools, if not well treated, can be cesspools of diarrhea and bacteria.
It's about our health. You are getting into this pool. You walk in when you're healthy. And then you end up leaving our pool when you're sick. I don't think you'll come back. I'm not in business.
The CDC study notes that some facilities have failed to keep their water clean, on top of having no restrictions on who gets into the pool.
We consider cleanness of the pool, one. Two, we also consider the swimmers. We advise them to bathe before swimming, before getting into the pool. And when you have an open wound, and when you have a skin disease, we don't allow you into the pool.
Also, it was found that some bacteria have the ability to survive for more than 7 days under the recommended chlorine levels, meaning it takes high amounts of the chemical to eradicate the parasites. But Taban says treatment of a swimming pool is not just about dumping chlorine into the water.
Treatment is done in the evening. We don't do treatment in the morning. And the chlorine should be 1.0 to 1.5. That is standard. But then when it exceeds to 2.0, then the chlorine becomes too much in the water. You give it a little bit like some 3 to 4 hours with our pool. Because our system is a modern pool, the system is big. It gives us 2 to 3 hours and the pool is ready. But residential pools, with small filters, you treat in the evening until tomorrow. But when you see me treating the pool in the morning, I think it's an emergency. Maybe the pumps didn't run well at night.
We spoke to Dr. Vincent Karuhanga of Friends Polyclinic to explain the health risks associated with dirty pools.
You'll find that people walk barefoot around the swimming pools, and here they can easily pick up athletes' foot. Many of our swimming pools are having stool particles, they're having urine in them, they're having semen, they're having so many things in them.
He says while swimming, one takes in water from the pool, which leads to ingestion of bacteria like E. coli.
Now, when you drink the water or the water goes into your mouth, you are likely to get diarrheal diseases. The biggest problem is that now germs are becoming resistant to chlorine.
Throughout his experience, Taban says one can tell that the chemicals in the pool are not conducive for them to swim.
When you swim in a highly chlorinated pool, you get red eyes, you get pale skin after swimming, especially ladies break their hair.
Taban, however, says he is disappointed that the Kampala Capital City Authority has not picked interest in supervising swimming pools, yet many schools have made swimming a mandatory activity for children.
If the KCCA can do something about the public pools, would save us, would save most of our swimmers. People have pools, but their pools are in a very poor state. And they kind of, I've never seen a KCCA visiting this pool from the time we started. It's now 12 years down.
Officials from KCCA were not readily available for a comment on this issue, but an official from the National Environmental Authority, NEMA, who preferred not to be mentioned, said there is no law on disposal of recreational water, but it is advisable that your pool is connected to the sewer line. Even though it's not easy, try your best not to swallow any water. But most importantly, listen when the pool attendant or medical doctor says, "Don't swim if you are sick." Walter Mwesije, NTV.